The state pension and the health plan are going to consume over $4 billion of the annual state budget every year for the next 15 years. That's before debt service. That's before any of the other core functions of state government. The reason is twofold. On the pension plan, it's the result of lower interest rates, which has resulted in the pension plan not earning its required rate of return on average for the last 15 years. It's also associated with the blessedness of increased life expectancies, which the pension plan never anticipated. On the health plan, it's the result of, for decades and decades, we are and still continue to be on a pay-go basis, where no money was ever put aside for people to be eligible for lifetime health care. And now that bill is coming due in a very rapid way.
In some respects, it sounds as if North Carolina is facing at the state level some of the same challenges the federal government is facing with things like Social Security and Medicare. All of these promises building up over time, and now this bill's coming due.
Right, but the difference in this topic and the federal topic is that they don't have GASB standards that they have to live under. They don't have what we call CAFRs, the audited financial statements. The accounting standards boards are requiring not only the state, but for your listeners, every county, every city, every school district, every governmental entity is now going to have to account for these long-term invisible liabilities going forward.
Plus, we can't print money and run deficits, can we?
Yes, I didn't want to bring up a blind glimpse of the obvious, but those are both very true.
So setting out that issue and how much these obligations are going to cost, what is it that you're trying to bring to the attention of policymakers about what we need to be doing to address these things?
Well, number one is we're trying to get to the bottom of it. And sometimes when you think you're at the bottom of something, you're really not. And obviously that's what I'm finding at the Treasurer's office. The second thing is that we didn't do these things. I've been working on this for 10 years, so I feel like I have some ownership in discovering them. But now I have the responsibility of fixing them, and that's a tall order. What we're trying to do is we're trying to reduce complexity and build value. Now, let's start with the pension plan. We have 175 money managers managing 360 different funds, charging us over $600 million in fees every year. So we're trying to reduce the complexity by making sure that if we're paying somebody to actively manage our pension plan, that we're getting value over and above what we could get if we were in an index fund, which costs nearly nothing. On the state health plan, I don't think we have enough time in this interview to talk about how I'm reducing complexity and building value, but there's one tragedy in all this, and it's a strong word to use on a financial topic, but it's absolutely true. We have prison guards and beginning troopers and teachers and other beginning state employees who, if they choose family coverage this year, had to work 5 days out of every work month just to pay the family premium. Now, I say tragedy because the largest purchaser of health care in North Carolina is the state health plan. And the fact that we can't do it better and more efficiently on behalf of beginning teachers, troopers, and state employees, to me, is a tragedy. And mathematically, it's the reason we have the problems in our system, because it's made up of people my age and above who just take the individual coverage. So we have literally driven away all of our young, healthy people out of the state health plan, so it's made up of people like me. And my point of telling you that is that we're going to reverse that. And so we're going to do that by reducing complexity and building value.